Okay, so this is Michael Knott, this is my husband, and you agreed to this video, correct?
Yes.
Okay. So I got my pen light, my pen, my notepad, and my stethoscope. So I'm good to go. Okay, so first I'm going to knock on the door, wash my hands, and introduce myself. Hi, Michael. My name is Autumn. I'm going to be your nurse taking care of you today. Can you tell me your name and date of birth?
Michael Knott, 7/11/1988.
I'm looking at his wristband, making sure I have the correct patient, and I do. So I'm going to provide for privacy, shut the curtain, shut the door if needed. I'm going to come over to him and I'm going to let him know that I'm going to be doing a physical assessment. So basically what I'm doing is I'm checking you from head to toe to make sure that you don't have any abnormalities. Is that okay with you? He says okay. I'm lifting his bed up. As I'm doing this, I'm doing a general assessment. Is my patient well groomed? Is he disheveled? Is he dressed appropriately for the weather? Is there any clutter? If so, I'm going to clean that up. I'm looking at the lines and the tubes, making sure that's okay. If he's on oxygen, is the liters correct for what he needs? He is good, so we're good there. Okay, so I've already gotten his vitals, his blood pressure, his temp, his respirations, his O2. I got his height and weight. We're good there. I'm gonna ask him about his pain. Are you having any pain?
No.
No pain? How are you doing with being in the hospital?
Good.
How are you coping?
Good.
Okay, so he's good there. Okay, so I'm gonna do the neurological assessment. Can you tell me your name?
Michael Knott,
The year.
2025.
Okay, and who is our president?
Donald Trump.
Okay, so speech is appropriate. He's oriented ×3, so we're good there. Okay, so I'm gonna go ahead and start. I'm gonna look at his head, palpate around, look for any irritations, any lice, bugs, nits. His head is symmetrical, so we're good there. Okay, no lumps, no nothing like that. Okay, okay, so I'm gonna take my pen light. I'm gonna look at his external canal. I'm looking to see any irritations, any lesions, any buildup of earwax. He's good over there. He's good over there as well. Okay, so I'm gonna do a whisper test.
Cat.
Okay. And then I'm gonna do a whisper test over here.
Dog.
Okay, so his hearing is good. We're good there. Okay, so now I'm gonna do his eyes. I'm gonna check for perla, make sure the pupils are equal, round, reactive to light, and accommodating. So when I turn my light on, does his eyes constrict? Which they do. They're equal and round. They accommodate because they cross, so we're good there. I'm gonna do the cardinal field of gaze. So I'm gonna have you follow my pen light, up, back, side, back, down, back, up, back, side, back, down, back. Good there. Can you tell me the color of this?
Pink.
What's the number right here?
8.
Okay, so we're good there. I'm gonna look at his conjunctiva, which is the whites around the eyes. Looking to see if they're yellow, if so that's jaundice, or if they're bloodshot, they are not. Looking at sclera, nice and pink. If it was white, that's a sign of blood loss, like in trauma patients, but he's good. Okay, so we're good there. Now I'm gonna look at his nares, look at the pink mucosa, look for drainage, look to see if he has a deviated septum. Any foreign objects? No, he's good. Looking at his lips, they're nice and pink. They're not blue, they're blue. He's losing oxygen. Looking inside the mouth, looking at the mucous membranes. His hydration status is he's hydrated. If he was dehydrated, it'd be dry, and his tongue would be like fuzzy, furry, that type of thing. I see no broken teeth, no lesions. We're good there. Okay, so we're good. His skin is warm and intact. Looking at his neck, I'm palpating around, feeling for swelling. Accessing the cervical lymph nodes, don't feel them, he's good. Okay, so we're good there. Okay, so turn around. I'm gonna access your posterior breast zones. I'm looking at his back, making sure there's no lesions, any scars, any masses, anything like that. His skin's intact, it's warm, the collar's appropriate for his race. We're good there. I'm gonna listen to your breath sounds. Every time I move this, please take a deep breath in and out. 10 times and comparing bilaterally. Okay, his breath sounds are normal, no rocking, no crackles, no wheezing, good there. Okay, same with the front. Looking at his stomach, nice, warm, intact, collar is appropriate for his race. No masses, no lesions, no scarring. Same thing. Okay, 10, perfect. Okay, so good there. Now I'm gonna listen to your cardiovascular, so I'm gonna listen to your heart. Okay, so aortic, pulmonic, herbs, tricuspid, and then the mitral. Okay, so I hear the S1 and S2, the lub dub. I don't hear any extra sounds, which would indicate like he had a murmur. He is good. The rhythm and the rate is all good. We're all good there. Okay, so we did all of that. So now I'm going to access his pulses. I'm going to start with his temporal. Carotid, you can only use one. Brachial, radial, popliteal behind the knees, dorsal pedis on the feet, and then the posterior tibial in the back of the foot. Okay, we're good there. So now I'm gonna listen to his bowel sounds. You can go ahead and lay down. I'm gonna ask him when's the last time he had a bowel movement.
This morning.
Can you tell me the color and the size?
Brown and normal.
Normal, okay. Okay, so I'm not gonna fill yet because if I do so, it's gonna create noises that's not normally there. But I'm gonna listen to his quadrants. Oh, so right lower, right upper, left upper, left lower. And I do hear the gurgles and clicks, so it's very normal. Don't hear anything crazy. Now I can palpate, so I can feel around, see if I feel any masses or anything abnormal. And I don't. Access McBurney's point. And when I let go, do you have any tenderness?
No.
Okay. If he did have tenderness, that would indicate that he could possibly have appendicitis, but he's good. I'm going to feel the bladder to see if I feel any distension. I don't feel any urine in his bladder, so we're good. His stomach is symmetrical. His skin's intact. It's nice and warm. We're all good there. Okay, can you tell me when's the last time you urined?
30 minutes ago.
30 minutes ago. What was the color of it?
Clear.
Did it have a smell?
No.
And the frequency, did you have the urgency to use the restroom? Do you have
Normal.
trouble using the restroom?
Normal.
Okay, does it burn when you pee?
No.
Okay, so we're good there. Okay, so after that, I'm going to look at his upper extremities. So same thing, I'm looking to see if there's any lesions. His arm, the skin's intact, everything's good, nice and warm and dry. No edema. If so, I would look for petting 1, 2, or 3. He has none of that. We're good there. I'm going to access a skin turgor. It rebounds quickly. Okay, so he's not dehydrated. And I'm going to check his capillary refill, and they are filling back up within 3 seconds. Okay, so we're good there. And then I'm going to test his motion or range of motion. He can do this himself. Okay, so go ahead, and this is active because he can do it himself. Do you have any tenderness at the joints?
No.
Okay, so he's good there. Okay, grab my hands, squeeze. Okay, so he's got strength there. Same thing with his legs. I'm going to look for edema. He has none. Lesions, sores. He's all good there. Skin trigger on the feet. And it rebounds quickly. Capillary refill on the toes. And it returns within 3 seconds. I'm looking in between the toes as I do this to make sure that there's no sores or anything like that. I'm looking at the bottom of his heels because you could get pressure ulcers on there. No pressure ulcers. Okay, so range of motion, I'm just gonna kind of have him like move his hip around. Any tenderness?
No.
Okay, go ahead and push. Okay, he's got his strength. Same thing here. Push, and then move your range. No issues there?
No.
Okay, so we're good there. Okay, so I'm gonna have him stand up, and I'm gonna look at his back. Okay, his spine's good, no abnormalities. I'm looking at his hips, his butt, and his coccyx, no pressure ulcers, he's good there. And I'm gonna test his gait. So walk to me, turn around, walk to me on your heels. Okay, and then go back on your tiptoes. Okay, good there. You lift a piece of candy for me? You can go ahead and sit down. His gait is good. All that is great, no abnormalities. So at this time, I'm gonna go ahead and lower the bed back down, put my patient in there. Safety, rails up. His coli is near him. If he has his drink or anything like that, that's nearby. His O2 is good, all that's good. I'm gonna wash my hands. I'm gonna go document an EHR about how he reacted to this procedure, and then all the stuff that I documented on my little tiny notepad. Okay, so we're all good?